Now, the challenges of designing effective strategies to stem HIV/AIDS infections among various segments of society has been a subject of discussion among stakeholders. For more perspective on what must be done to achieve the goal of an AIDS HIV-free generation, I'm joined by Dr. Nicholas Muraguri, Director of Global Plan Secretariat, UNAIDS and PEPFER. Dr. Muraguri, welcome to In Focus.
Thank you very much.
And we heard that from President Chisan also saying an AIDS-free generation, especially talking about Africa. What really has to be done to ensure that?
First of all, we need to understand that over 400,000 children were born with HIV last year. And 90% of them come from sub-Saharan Africa, in fact, in 21 countries. The interventions or the solutions to avoid HIV among children are known. And therefore, the challenge now is to ensure that those interventions are known to work are actually scaled up within sub-Saharan Africa.
And now we have actually heard of women who are giving birth to children who are HIV negative, although they are HIV positive.
Yes.
Just break it down. What must somebody do to make sure they have a child who is negative?
We usually talk about 4 prongs. Prong number 1 is to ensure that we reduce HIV infections among women of reproductive age. Very important. Number 2, we need to ensure that women who are HIV positive must access family planning services so that they only get pregnant when they want to. And the third one, should a HIV positive woman become pregnant, then we must provide interventions for her to be able to not to infect her baby. And that means she must access antiretroviral therapy, either for her own treatment or for prophylaxis. And number 4, should she then give birth to a HIV-positive child, that child then must access treatment and herself must access treatment to remain alive. So all these 4 prongs must then be implemented at the same time so that we're able to then reduce the number of new infections among children. It has happened in Europe, it has happened in America, and it was possible within sub-Saharan Africa.
Now, you serve the sub-Saharan region.
Yes.
What are some of the challenges you're facing in providing this 3-prong strategy to women in those countries affected?
Unfortunately, a lot of women of reproductive age are still getting infected. Largely, if you look at sub-Saharan Africa, 60% of people living with HIV are young women. So that is really worrying, because then they're potentially mothers in the future. Therefore, we must really double our effort. So we're still concerned about the new HIV infections. We're still concerned about limited access to interventions that are known to help these women either avoid infections or avoid affecting their babies. And of course, the whole environment about access to core services that they need. And of course, social and cultural environment that make it more vulnerable for women to get HIV. So all those things are in an environment where these things are happening. But at the same time, some progress have been made, which we must recognize. If you look at the last year's report, which has been launched this year, there has been a 25% reduction in new HIV infections among children. We moved from 360,000 infections to 270,000. Progress has been made, but we need to move faster than the current progress.
Tell me about the political will and how well the governments are doing in helping implement these programs and setting aside budgets for this.
African leadership and African Union have adopted what they call an African plan for elimination of HIV among children. So at that highest level of leadership, at the presidency, they have accepted and developed a plan under which they're implementing. And part of that plan includes promoting domestic resources or increase domestic resources towards the national response. Because largely, a lot of responses in Africa, up to 85%, are donor funded. We are now calling for African leadership to even put their own money, domestic resources, towards the national response. So the plan is robust. It talks about leadership, African leaderships, providing whatever is required environment for people to access services, at the same time being more accountable. So it is them, it is African problem, and therefore African leadership must be held accountable for the results.
Wow, yeah, that's a powerful message. Well, thank you very much, Dr. Muraguri, for giving us those insights. Dr. Nicholas Muraguri is Director, Global Plan Secretariat, UNAIDS and PEPFER. We thank him for joining us today.